This segment of DelmarvaLife is brought to you by TidalHealth.
Keeping everyone involved on the same page is vital when it comes to healthcare. That's why in 2009, the HITECH Act was passed. It assured the usage of electronic medical records that technology can also provide healthcare workers necessary feedback following important medical procedures.
And such is the case at TidalHealth. The TidalHealth Surgical Navigation Team is incorporating MyChart for patient-reported outcome measures, or what they call PROM. With more on that this afternoon and why it's so important to you, this is Cheryl Presto. She is the Surgical Spine Coordinator with TidalHealth. Thanks for joining us this afternoon.
Thank you.
Thank you. Thank you for having me.
We've talked about it before.
Yes.
But for those who don't know, tell us what MyChart is.
Absolutely. MyChart is 24-hour, 7-day-a-week access to your medical record. So for regular people like you and me, we can go on with a little bit of limited access. You can't look at everything, but most things. You can go on to your MyChart and you can look at things like your lab work. You can make appointments for your physician. You can change appointments. You can even message your physicians and get responses back. Wow. It works very, very well.
So how do you get involved in it? How do you sign up?
The easiest way to do it is when you are either on campus at one of our hospitals, or if you're at your doctor's office, we can send you a link right to your phone and you can immediately just verify your birth date and then develop your own log-on and sign in, and you're good to go.
And you're off to go.
Yes.
So what is surgical navigation?
Well, that's what I do. I'm the Surgical Spine Coordinator. I work with patients who are getting ready to have surgery somewhere on their spine. So we bring patients to a classroom and we teach them everything they need to know about preparing for their surgery, what to expect while they're at the hospital, and then how to take care of themselves when they get home from the hospital.
Okay, so now we're going to connect the two.
Yes.
Why is it important for patients to have MyChart when they're doing the surgical navigation?
Absolutely, for a couple of reasons. First of all, it will notify them of when their class date and time is and send them a reminder. And secondly, with our PROM, or patient-reported outcome measures, we send those to the patient via their MyChart. So in their questionnaire section of MyChart will be a questionnaire related to their specific surgery. In the case of my patients, it'll be related to spine, and patient-reported outcomes are just that. It's the patient's perception of where their medical condition is prior to their surgery, but they're also going to see that same exact questionnaire again at 3, 6, 9, and 12 months post-op. And our physicians look at, or our surgeons look at this outcome data, because what we're looking at as a hospital and our surgeons, are we doing the right thing?
Right. So to be a part of the patient-reported outcome, you need to be part of MyChart.
You need to be part of MyChart. We no longer do it on paper. Yeah. It is through MyChart. Very important.
Now, that's just a whole nother set of logins and passwords. We have so many. What happens if you forget yours and you can't get into MyChart?
Absolutely. The easiest thing is right on your application, just like any other website, there is I forgot my password, or I forgot my sign-on, and you can click on there and get help. If you can't remember how to do that part, or it frustrates you, you can always call our MyChart support line, which is 410-543-7450, and there will be a live person to help walk you through the process.
Very simple.
Yes.
Cheryl, thank you so much.
Absolutely.
TidalHealth.
Thank you for having me.
Wonderful talking to you.